Okay, welcome to the deep dive. You've handed us quite a bit of material here, articles, research papers, all focused on a really tough subject. What people sometimes call German Shepherd sudden death syndrome.
Yeah, it's a difficult one.
So our mission today is to really dig into this material you've provided, pull out the essential insights for you, and try to make sense of it all.
And I think right off the bat, we need to clarify something the sources make really clear. Sudden death syndrome, well, it isn't actually a specific medical diagnosis itself.
Right, it's more like the outcome description.
Exactly. It describes that tragic endpoint. And in German Shepherds, the information you gave us points overwhelmingly to one specific inherited condition as the usual cause, inherited ventricular arrhythmia, or IVA.
IVA of German Shepherd dogs, specifically. So that's our focus, IVA. This often silent electrical heart issue. We're using only your sources here to explore what it is, why it happens.
Who it affects, when it affects them.
Yeah, and how incredibly hard it seems to be to spot before something terrible happens.
Yeah.
Then looking at how vets diagnose it, manage it, the prognosis, prevention. It's that suddenness, isn't it? Healthy young dogs.
It's heartbreaking. And IVA is definitely the most common inherited reason behind that sudden death scenario in GSDs, according to this research.
And a really key point from the sources is that IVA is a primary electrical disorder.
It's not usually about the heart muscle being weak or valves leaking, that kind of thing.
It's the wiring.
It's the wiring, literally. The electrical signals controlling the heartbeat are the problem.
Okay, so if it's the wiring, what do the sources tell us about the why? Genetics.
Oh, absolutely. The material points very strongly towards inheritance. Now, the exact genetic mechanism, well, it's described as complex, still being figured out. The papers mention possibilities like maybe it's autosomal dominant, but with incomplete penetrance.
Meaning you inherit the gene, but might not get the severe form.
Exactly. Or it could be polygenic, multiple genes involved. It's complicated.
But the core issue is those abnormal electrical signals firing off from the ventricles, the main pumping chambers.
Precisely. The heart just starts adding extra unscheduled beats. Your sources describe a range from, single extra beats, they call them VPCs, ventricular premature complexes.
Like a little electrical hiccup?
Sort of, yeah. Or maybe pairs of them, couplets. But where it gets really dangerous is when you get rapid runs of these beats. That's ventricular tachycardia, or VT.
Correct.
And sometimes that VT is polymorphic, meaning the electrical pattern changes beat to beat, which is often even more unstable.
So the heart's rhythm just goes completely haywire, way too fast.
That's a good way to put it. And the fatal step, the sources explain, is when that super fast, chaotic VT degenerates into ventricular fibrillation, VFib.
VFib?
Yeah, at that point, the heart isn't pumping anymore. It's just quivering uselessly, like a bag of worms is the classic description. That leads immediately to cardiac arrest. No blood flow.
The sources mentioned a couple other potential factors too, didn't they? Things that might contribute.
They did touch on a few other possibilities, yeah. Like maybe abnormal sympathetic nerve connections to the heart, or some issues with how heart muscle cells handle calcium, which is key for electrical function. These might make that underlying inherited risk worse.
Okay, this gets us to a really critical point. Who gets this? And maybe even more crucially, when?
The research here is very specific. Breed: German Shepherds. Age: primarily young dogs.
How young?
The main risk window highlighted is between about 3 and 24 months of age.
3 months to 2 years old.
Right. But there's an even tighter peak risk period for sudden death within that window, often hitting between 4 and 9 months old. That seems to be the most dangerous time.
4 to 9 months. Wow, that's just puppies, really.
Yeah.
But here's something in the material that really jumped out at me. It sounds almost contradictory. Dogs outgrowing it.
Yes, this is honestly one of the most striking and frankly hopeful things in the papers you shared. It clearly states that many affected dogs, if they can just survive past that critical early period.
Past the 18 to 24 months mark.
Exactly. If they make it past roughly 18 to 24 months, the dangerous arrhythmias often just fade away. They spontaneously regress significantly.
Really, they just disappear.
Or become much, much less severe. Their risk of sudden death plummets. And the sources say they can then go on to live a normal lifespan. One paper mentions over 12 years.
That's incredible. It's like a race against time in those first 2 years.
It really is a strange biological paradox. Huge risk early, then potentially okay later.
Which makes the clinical signs even more tragic. What do owners actually see, according to these sources, before the worst happens?
Well, this is the gut-wrenching part the sources emphasize. Often, nothing. The absence of obvious warning signs.
No warning at all.
In many cases, no. The dog appears perfectly healthy, active, playing 1 minute.
And then the collapse or death is literally the first sign something's wrong.
Yes. And it often happens during quiet periods, while sleeping or resting after they've been active. Sometimes, though, it's triggered during or just after exercise or excitement, especially if they were resting right before. The sources mention early morning being a common time, too.
Wow. And the papers specifically say there's usually no prior history of fainting or trouble keeping up during exercise.
Typically not reported, no. That's what makes it so devastatingly unexpected. Now, could there be subtle signs? Maybe. But they're clearly often missed or just not recognized as alarm bells.
Which, of course, makes diagnosing this in a live dog that looks perfectly healthy
Yeah.
incredibly difficult. It sounds like a real challenge for vets based on this information.
Oh, absolutely. The sources frame it very much as a diagnosis of exclusion.
Meaning you have to rule everything else out first.
Pretty much. Vets have to systematically check for and eliminate all other potential causes of sudden death or arrhythmias. The lists in your sources include things like structural heart disease.
Like valve problems or muscle diseases.
Right, things like subaortic stenosis or ARVC, though they note ARVC is way more common in boxers, it's still considered. Also, myocarditis, that's inflammation of the heart muscle.
Okay.
Then there are non-heart causes. Metabolic problems like kidney failure, electrolyte issues, toxins, certain infections like Ehrlichia, even totally different emergencies like bloat, internal bleeding, severe allergic reactions.
A lot to rule out. So if the standard stuff, routine blood tests, urine test, even a heart ultrasound and echocardiogram,
Yeah.
if those usually look normal, because the structure is okay, right? It's the electrics.
Exactly. The echo is mainly to rule out those structural problems. It's typically normal in IVO.
So if those are normal, what's the absolute key diagnostic tool the sources point to for live dogs?
The material is unanimous on this. The most important diagnostic tool is 24-hour ambulatory ECG, or Holter monitoring.
The portable heart monitor they wear.
Yes. The dog wears it usually for a full day, sometimes two, while living its normal life, sleeping, eating, playing. It records every single heartbeat.
Why is that so crucial?
Because these dangerous arrhythmias the VP runs, they're often intermittent. They might not happen during the 10 minutes the dog is hooked up to an ECG at the vet clinic. You need that long recording period to actually catch them happening. The sources call it the gold standard for diagnosing IVA in a living dog.
And digging deeper, the sources even say that a post-mortem exam, the necropsy after death, often doesn't find a clear cause.
That's right. Which, again, really hammers home that this is an electrical issue, invisible to the usual structural examination after death.
So let's talk treatment. This sounds tough to treat if it's so unpredictable. Can it be fixed?
Well, this is another really challenging aspect presented in the sources. The hard truth is, no treatment has been consistently proven to actually reduce the risk of sudden death in dogs with IVA.
No guarantees.
None mentioned. So the focus of management, when it's tried, is really about trying to suppress those dangerous arrhythmias, trying to quieten them down.
What kind of drugs do the sources say vets might use?
They mention lidocaine, but that's usually IV for emergencies. For ongoing oral meds, they talk about combinations, specifically sotalol plus mexiletine.
Okay.
But there's a big warning. Sotalol used alone can apparently sometimes make arrhythmias worse in these dogs. So that combination seems key.
And does it work?
The sources stress that the response is highly variable. Some dogs might respond well, others not so much. It's unpredictable.
So how do you even know if the meds are doing anything?
Repeat Holter monitoring. It's essential. You put the dog on the meds, then you do another 24-hour Holter to see if the frequency or severity of the ventricular tachycardia has actually decreased.
Makes sense. Did the sources mention anything else? Pacemakers. Defibrillators like in humans.
They touch on them. Pacing studies apparently showed it might reduce how often VT happened, but didn't stop the dogs from dying suddenly. Implantable defibrillators are mentioned as, theoretically possible, but really complex to manage, program, especially in young, active, growing dogs. Not a standard thing at all.
What about, say, if a young GSD with this potential needs surgery for something else? Anesthesia risks.
Good question. Yes, the sources flag that. Even dogs without symptoms can develop serious arrhythmias under anesthesia, especially if their heart rate drops too low, which anesthesia can do.
So,
So they advise using specific drugs, anticholinergics, to help keep the heart rate up during procedures, particularly in that high-risk age group under 2 years old.
okay. Now, does every dog with any funny beat on a halter need this kind of intense medication?
No, the sources make a pretty important distinction there. Treatment is really only considered necessary for dogs confirmed to have runs of ventricular tachycardia.
The fast, dangerous rhythm.
Right. Dogs who only show those single extra beats, the VPCs, they typically don't die from this condition, according to the papers.
Okay.
But they do recommend monitoring young dogs who only show VPCs initially, repeat halters, because their electrical pattern, the phenotype, can change during that risky age window. VPCs could potentially progress to VT later on.
Which leads us directly to prognosis. This sounds pretty concerning, especially for those young dogs.
It is. It's described as guarded, particularly in that really critical 4 to 9 month window we talked about.
How guarded? Are there numbers?
Yes. The sources provide a really sobering statistic. Approximately 50% of dogs identified with significant VT on a halter,
And significant means.
defined in the papers as more than 10 runs of VT in 24 hours.
Okay, 50% of those dogs.
Within that high-risk age bracket may die suddenly before they even reach 1 year old.
Wow, half of them. That really highlights the danger if VT is found early.
It really does. But then there's the flip side, that paradox we mentioned. If a dog does not have VT found on a 24-hour halter,
Their risk is low.
very low probability of sudden death from IVA, the sources say. And crucially, even if they do have VT detected, but they manage to survive past that initial danger zone.
Past the 18-24 months.
Exactly. Even if they were quite severely affected electrically, the arrhythmias often spontaneously regress. They tend to go on and live a normal lifespan, potentially, as one source put it, over 12 years.
So incredibly high risk, but concentrated in time.
Precisely.
So given everything points to this being inherited, what's the bottom line from the sources on prevention, on breeding?
This is probably the most actionable part. The sources are very clear and quite strong on this point. Breeding from lines known to have affected dogs is strongly discouraged. Period.
Avoid passing it on. Makes sense. Do they suggest screening breeding dogs?
Yes, definitely. They advise breeders to work with veterinary cardiologists and really consider screening potential breeding animals, especially if there's any family history of unexplained sudden death in young German Shepherds and their pedigrees.
And the screening tool would be?
Halter monitoring. Using that 24-hour ECG on potential breeding stock, even if they look perfectly healthy, is suggested as the key screening method right now.
Because a genetic test. That would be the dream. But the sources indicate that still research not available yet.
That's correct. A specific DNA test for IVA in GS-SDS is something researchers are working towards, but it's not currently available for breeders to use. So screening relies on detecting the actual arrhythmias.
Okay, let's try to pull this all together then, based on the source material you gave us. We're talking about inherited ventricular arrhythmia, IVA. It's a silent, inherited electrical problem in the heart, primarily hitting young German Shepherds.
Right, often with no warning signs.
The tragedy is its suddenness, striking seemingly healthy dogs, especially hard between 4 and 9 months old. Diagnosing it while the dog is alive is tough, needs vets to rule out other causes, and critically needs that 24-hour Holter monitor to catch the dangerous fast heart rhythms.
Because routine tests, even a necropsy after death, often show nothing specific.
And treatment. Well, there's no magic bullet, no guarantee prevents sudden death. Management focuses on trying antiarrhythmic drugs, but response varies and needs careful monitoring with repeat Holters.
Which puts a huge emphasis on prevention.
Exactly. Careful breeding choices, avoiding affected lines, using Holter screening on breeding dogs. That's presented as the most powerful tool right now. And then there's that really weird, almost hopeful twist. If they survive past about 2 years old, the problem often just disappears on its own.
That really captures the core message, the high-impact info from the material you shared. It's definitely a complex and concerning picture, but those are the key takeaways.
We've certainly gone deep into the information provided on this very challenging and often heartbreaking condition.
We have. And maybe as a final thought, something to ponder from these sources. There's that deep biological puzzle, isn't there? Why is the risk so heavily concentrated in young dogs? What changes as they mature past 18 or 24 months that allows these dangerous electrical faults to just vanish in many cases?
Yeah, what could that spontaneous regression tell us about how the heart's electrical system develops or remodels? Could that hold clues for the future?
Maybe. Or, thinking more practically right now, given how silent this is, the high risk in young GSDs, and without that perfect genetic test yet, What are the absolute most crucial proactive steps a responsible breeder or even an owner of a young GSD from potentially at-risk lines can take today? Leaning hard into that screening, the Holter monitoring, and making really informed breeding decisions based on the knowledge outlined in these sources. It definitely leaves you with some important things to think about.